So you might be thinking, I know I need to make a change. I know I need to help myself get out of the tightness, the tension, the pain that I'm feeling, but I just don't know where to begin. And if that's you, this video is for you. I'm going to guide you through 3 positions that we can do to help to create space in the body, connect to that diaphragmatic breath, and this will help to ease the tension, the stiffness, the pain that you're feeling. So hello, my name is Catherine. I'm a block therapy instructor and fascia alignment coach, and I use block therapy's tools to help myself with tightness, pain and tension, and to help others through online classes, in-person classes, and also one-to-one work. So in my last 2 videos we talked about how pain can make us exhausted, how we're too tired to be able to help ourselves get out of that pain, that tension, that stiffness that we feel, and how we're putting ourselves last because of all the things we have to do, and we're not seeing this as a priority. We're not putting our self-care as top of the list, and when we're exhausted and in pain, it's difficult to do that because our energy is getting drained every time we are trying to move through and do all the activities we need to do each day. So this is a routine that you can do in bed. You don't have to do it on the floor, you can do it in bed. You can even start to do this in a chair. So wherever you are, if you've got 3 minutes, each position should be done for 3 minutes as a minimum. The reason we need to do it 3 minutes as a minimum is to start that melting process. You can always stay in position longer. So I'm going to show you 3 positions that you can do to help to start to get that tension and that pain out of the body. The first position we always do is the belly position, and this belly position just helps us to connect to the diaphragmatic breathing. So you'll need to have a rolled up towel, and there should be a link on my screen now showing you how to roll a towel up, but you just want to tightly roll up a medium-sized towel. The block therapy block is a wooden block, and it's similar then in size. We always use a rolled up towel rather than a yoga block or anything else, because the towel will have the density that we need and the softness that we need. Those corners are nice and rounded on the block, and the density is obviously, it's a solid wooden block, but starting with the towel just helps you to ease your body into positions when you've not done this work before. So placing the towel where the belly button is, and if you're doing it in a chair, you would just add pressure and lean forward. And then if you're doing it on the bed or on the mat, you can lie on your back and add pressure the same, or you can lie on your stomach and then lie on top of the towel. So you want to be doing this very slowly. So just coming down to the mat or the bed, lowering yourself down, finding that belly button area, and then connecting to that breath. We want to be supporting the body, so if you're not able to stay up on your elbows, get some pillows, cushions to support you, or if you feel comfortable straight away, you can come all the way down and lay your head on the mat or the bed. And then we want to be breathing diaphragmatically, so breathing in and out through the nose if you can, in for a count of 4, and feel that belly expand on the towel. It's kind of pushing your belly on the towel, and then exhaling for a count of 6, feeling that belly going small, imagining that belly button's going to the back of the spine, and just keep breathing like this. You will feel pain and pressure, that's normal, and maybe even a pulse, that's the aorta. The pain and pressure can be due to numerous things: inflammation, undigested food, waste that's not been eliminated, and just the tension and tightness that we might be feeling. So just relax in this position for 3 minutes, melting away that restriction and opening up space in this area. So with block therapy, even though we may not have pain in the stomach, we address the stomach to connect to that breath, and we address the full body, because wherever the pain is, that's not necessarily where we want to start. We're not chasing the pain. We want to open up the body so that the space that's been lost will then help to melt away those restrictions, which will then support the areas of the body that are in pain. So even though you may have back pain, foot pain, shoulder pain, we always start in the belly position, and these other positions I show you will be suitable for you because we're opening up the front of the body to create that space and that blood flow. Once you've done your 3 minutes, you want to very slowly place your hands under your shoulders and exhale up and out of position. Now the next position we're going to do is the sternum, but tightly roll up that towel again because it may have collapsed just or unrolled due to that first position that we did. So the sternum is in between the breastbones here, in between the chest. So again, don't worry exactly where you are, anywhere is fine. And you can do this again by sitting in the chair and adding pressure and just pushing in and leaning forward. You can do this lying on your back and again holding it and pushing forward, or you can lie on your front, which is what I'll show you now. So again, we want to be very slowly coming down. We want to get right on top of that towel, and you can stay up on your elbows or you can come all the way down, whatever feels comfortable for you. And we want to be, again, breathing in and out through the nose, that breath, we're in for a count of 4, feeling that belly expand. And this time, as we expand the belly, bring the breath up to where the towel is, and then exhale. We want the breath to start from the diaphragm, but then you can bring it up to where the towel is, and then exhale it out the body for that count of 6. Again, you're searching for that pain, looking for the pain, and breathing it out of the body. You can make small movements, either left or right, so move it very slowly. When we collapse into the core, our shoulders round forward and we lose the space here. So we'll open up this space so that our lungs have more room so that we can breathe with ease. And when you've done your 3 minutes, you place your hands underneath your shoulders and slowly exhale up and out of position because you will have sunk quite deep into the towel. So the next position we're going to do is the hip flexors. So tightly roll up that towel again. Now to do this in a seat, you'd be sat on a chair and then find that hip bone, and you can place the towel here, and then you would just add pressure as you lean down into it. You do the left one and the right one, 3 minutes in each one. To do this on a bed or on the mat, just place the rolled up towel on the bed or the mat, bring out your right leg to the side, find that hip bone, the ASIS bone, and then you can stay up on your elbows if that's comfortable for you. Get some support cushions, we don't want to be collapsing in, or you can come all the way down. Connect to that breath, so breathing in for a count of 4 and out for a count of 6. When we're sitting down all day, this can get quite dense, this area, so it might take a bit of time to feel any pain in this area. So you can toggle forwards and backwards. You can just roll a little bit more to the outside or the inside. You can angle the towel a little bit so it's more into the groin as well. It doesn't have to be straight across. So just moving where you need to be. You can lift your foot up, so come up onto your toes. You can lift that leg up, but you don't have to do all these movements. You can just stay and connect to that breath, connect to the pain, the pressure that you're feeling, and breathe it out of the body. When you've done that side, exhale up and out of position, tightly roll up that towel again, and then move over to the other side and do exactly the same as we've just done. So those 3 positions will help to start to create space in the body. Due to time and the way that we stand and sit, our body falls into the core. Our shoulders round forward, so that sternum position helps to open up the chest. When we're sitting down, we are losing the space in the hip flexors. Depending on how our feet are angled out as well, our feet go out to the side, that shortens them. We shift our weight to one side, so we're creating space in this area, creating some flow that can go back down into the legs as well. So those were just 3 positions. In block therapy, we cover the whole of the body, and this is what we cover on my online classes and in-person classes. Wherever the pain is for you, the whole body needs to be covered, because it isn't necessarily the pain site that we need to be addressing to get ourselves to the root cause of the pain. So notice how you feel after those 3 positions. Do you feel that the pain has shifted? Do you feel that you're more open, able to sit up more? Do you feel calmer inside? Just noticing. And the more that you do this, if you can commit to do at least one of these positions every day or a few positions each day, you'll start to create that space in the body, start to use that diaphragmatic breath to strengthen that diaphragm so that we're breathing from the correct way. And all this will help with that tightness, that stiffness, that energy, that lack of energy that we feel when we're tired from all the activities that we're doing each day. If you enjoyed this session and like to have more, then I have online classes and in-person classes. There's a link in my description. So thank you for joining me today, and I look forward to seeing you in class soon.